Good afternoon. I'm George Latimer, Westchester County Executive, and this is our Westchester coronavirus update for Wednesday, December 23rd. There are 2 shopping days left before Friday, which is Christmas Day. And as a public service message to all my fellow men out there, this would be the day to start your Christmas shopping if you haven't started it yet. Time is running out, and you do not want to be at a gas and go on Christmas morning trying to figure out what is an appropriate Christmas gift to put under the tree Christmas morning. I say that with tongue in cheek, also knowing that there will be people out there this very evening and tomorrow trying to wrap up their Christmas shopping, and we hope everybody is ready to enjoy a very happy Christmas, even under the circumstances of COVID, which we'll discuss in the next few minutes. I'm joined by Deputy County Executive Ken Jenkins, and also by our Deputy Commissioner of the Emergency Services Department, Susan Spear. Both of them will be talking about some of the different issues that we're going to mention in today's report. We'll begin again with the news on the coronavirus update as of Wednesday, today, the 23rd. We do have accurate information from today on the coronavirus update from the state tracker. Right now, we show 64,560 total cases from the beginning of the pandemic. 56,372 of them are 2 weeks or more in duration, meaning that we have active cases as of today, 8,188 active cases. That number is up about 76 cases from yesterday. That's the first time in the last week that we've actually had an increase in active cases. It does compare favorably to a week ago where we had 8,750 cases. So what we were seeing is for 9 straight weeks an increase in active cases every single day. And then in the last 6 days prior to yesterday, those numbers had started to go down. It appeared to be a function of slightly less people testing positive over the course of the last week or so than they were testing positive 2 weeks ago. But it does reflect how many active cases there are out there that we know about. Any number of people might be infected with the disease who haven't been tested and are positive, either don't know it or haven't isolated themselves. But at 8,188 cases, that is our active case load for today. And we have tested in the aggregate 1,337,315 tests. That, of course, is well above the number of people in Westchester County, so it does reflect duplicate and triplicate testing. And I would say as a number of people tested, that's a very good number, that we're well over 100% of the people tested. Our last hospitalization number comes from Monday, 367 people hospitalized. That number jumped up from where we were for a couple of days before that. We were closer to 350. However, over the course of the last week to 10 days, we have been in that general range anywhere from 350 to 365 individuals hospitalized. So the number of 367 that traces back to Monday is actually slightly less than we were a week before that. But the number has oscillated up and down. We've had it as low as 353. And again, as high as 372. We're in a certain range, and I think just as we are with active cases, we're looking at numbers that are in round numbers flat for the last week. That's how I would interpret what we're seeing in terms of active cases and hospitalizations. What is not flat is our fatalities. We have now seen a sort of steady flow of fatalities that has been disconcerting. We lost 7 people last night for a total of 1,624. The night before that, we lost 6 people, 5 people the night before that, a couple of nights of 6, a night of 10. So this is a steadier fatality rate than we've seen before. It certainly reflects, I think, the higher numbers of hospitalizations than what we were having in the period of time prior to the last 10 days, 2 weeks, where we had hospitalizations that were lower and started to spike up. And without being able to connect the dots perfectly, I think it's fair to say that we've seen, in addition to the rising number of caseload in general, we saw a spike after Thanksgiving. And that spike after Thanksgiving might have been as much as 3 weeks after Thanksgiving, but it has resulted in higher hospitalizations, even if they flattened out a little bit for the last few days, and a higher number of fatalities. And all of that tells us that we're a long way away from being out of this tunnel that we're in. We've used the analogy, it's not an original analogy with me, that there's a light at the end of the tunnel. The light are the vaccinations that are ahead, and they're actually underway as we speak right now. But the truth of the matter is we've got a lot of tunnel to go until the full population is vaccinated, and therefore these numbers continue to be concerning. Now, we do have some particularly good news, and it's been a couple of days, week plus in the waiting, and that is we have now created and made available to all of you who wish to watch a dashboard that you can access online that will give you statistical data about the various communities broken into some pieces. I'm going to have Susan Spear talk about this in a second, but I just want to cover some of these things. You may remember that we suspended the hard copy map, which we distributed with each of these updates on a daily basis during the weekdays, 5 days a week. And we released it to the press, and it was static information for the day that we reported. It gave you initially the number of cases year to date, or total cases, number of positives. And then a little later on, a month or two into this, we were able to segment out active cases, the people who were currently within the 2-week protocol having been tested positive. And we report those numbers countywide, and we were able to break those down by community. But we made the point more than once that there was a lag time between data from the state and what we could report at the local level. This dashboard, I believe, corrects the greatest amount of that issue. So you will see when you go onto the dashboard, I assume you're looking at it as I'm speaking now, that you'll see that there are accurate numbers of number of cases, active total cases, active cases, broken down by municipality. The numbers basically add up to the numbers that we're getting off the state tracker. So that is a major step forward in reporting to you. You now do not have to wait for my reports. You don't have to look for a hard copy map, and certainly various publications will print them. The online publications have been doing that. But now you have a link, and you can look at it at any time that you'd like to, in the same way that you can look at the state tracker. Now, what this does do, and again, I'll have Susan sort of reinforce some of these things, is to codify data that we receive from New York State. I've made the point the last time we spoke about this, last 2 or 3 times we spoke about it, every data bullet comes from the state of New York, because every test for COVID, the testing centers report to the state their results. Every hospital, who's hospitalized, who is suffering and ultimately has a fatality, all of that data from the hospitals are reported directly to the state, and the same is true of the nursing homes. All of those entities are regulated by the state of New York, not by the county, not by the village, not by the city. So their obligation is to report this data to the state. And now through a direct linkage, we have the ability to access that data in the dashboard format that you have. If you look at this dashboard from your iPhone, the look of it's a little more compressed, not quite as easily to see it the way you'd like to see it. You do much better if you look at it on your laptop, where it spreads out more nicely and you can observe it. But now there is no reason for you to worry about a map. The map is now on that dashboard that you can access. You waited a while for it, and we indicated we were working on trying to provide this, and through the good work of our friends at Emergency Services, a couple of other parts, we want to thank them for their work. And before I turn it over to Susan, I want to specifically thank Connor Lynch, who's a GIS specialist with our Westchester County Geographic Information Systems area, and Ilir Toda, a software architect, also for Westchester County. They have talents and skills that you're seeing on display when you look at this dashboard. There are a few other things that are factored in. What it does not include is information that we are still attempting to get from the state on a regular basis, which would be information over hospitalizations. We have the aggregate number. We'd like to break it down municipally, and then also to break down the fatalities by municipality. And depending on how quickly that information is made available to us, we will update the dashboard with that information. We'll certainly announce it. We'll announce it, in the way we normally communicate with the press, and we'll certainly announce it in one of our updates. So Susan Spear, who is a member of our team here, the operations team, took the promotion over to become Deputy Commissioner of Emergency Services, and bang, just like that, we have progress on some of these things. So let me ask Susan to talk a little bit more about the dashboard that you're looking at. Susan?
Thank you so much, County Executive and Deputy County Executive. And I especially want to thank our Department of Information Technology, Connor and Ilir, who really stepped up to create this dashboard for the public. So at the County Executive's request, what we embarked on was a project to create a map that would be both user-friendly for everybody and also as informative and up-to-date as possible. So as you can see on the left-hand column, there is a breakdown by municipality. You can click on the bottom tabs to find new cases, active cases, and total cases. Also, one of the features I really like, on the map, you can click on your municipality and get the specific information for your own municipality or any other municipality you'd like to see. And then there's another tab there with testing information. So you can click on, it gives you information about how to go for a test and when to go for a test. And if you'd like, you can put in an address. And what will pop up is a map showing where the closest testing sites are. If you click on one of the dots that shows you a testing site, you can get the very specific information for that testing site that gives you the location, contact information, in some cases the hours that it's open, and specifically who they test and when they do the testing. So that's very user-friendly for people who feel like they want to go for a test. There's also some other cumulative and current information about the trends in positive cases over time throughout the beginning of the pandemic, and also some very specific information about our yellow and orange zones and what is happening in those specific areas. So with that, I want to again thank our information technology folks and the vision of the county executive for us to be able to bring this to you in a user-friendly way. Thank you.
Thank you very much, Susan. And again, thank you to both your department and our professionals in information technology for making this possible. This is not the final product that we strive for. We strive for additional information that will be available on this dashboard that citizens can interact with. I know that we went through a period of time where people were frustrated that they didn't have access to numbers, and we follow Facebook comments and postings. I would hope that you would have the confidence in this administration that we are trying and have proven over an extended period of time that we intend to do the things we say we're going to do. And when we say we're going to try to give you information in a more transparent, more accessible way, that this is an example of how we delivered it. But it does take time, and there are bumps along the road, and we're not finished yet. As I've mentioned already, we need to get additional data from the state. We hope to have that data. We hope to be able to put it on the dashboard, and then you too will have access to the information that you'd like to have. And as importantly, the municipal officials will have information that they feel is important for them to have in order to deal with the outbreak in their local areas. I want to mention a couple of other points. I'm going to ask subsequently Deputy County Executive Ken Jenkins to touch on a couple of other issues that are at hand. So the issue of vaccinations now comes front and center. We know that the Pfizer vaccine is out. The Moderna vaccine is in the process of being out, and it's been outlined that there's a certain protocol of who will get the vaccine first, that the priority, and it would be the Pfizer vaccine because that's the one that's been in the marketplace slightly longer, would go to hospital workers, the people who are on the front lines of the contagion, who deal with patients every day, and we want them to be healthy and secure. If they become sick, ill, unable to work, worst case scenario, we lose them through fatality. Those are the people that stand between all of us and the virus. And so we need them to be healthy, and that's why they get the first round of the virus. The vaccination process has begun in Westchester County. We've indicated that 3,466 hospital workers in Westchester County have already been vaccinated. 3,466 vaccinations already achieved in Westchester County through hospital workers. I would point out that both of the vaccines that we're talking about right now, the Pfizer and the Moderna vaccine, involve two treatments, and they are a certain number of weeks apart. I believe the Pfizer is 3 or 4 weeks after the first dosage, and then the Moderna one is slightly less. But in any event, it does require a second follow-up dosage, but the initial vaccines have been given to that number of people. EMS vaccinations start tomorrow officially. Our emergency services personnel are also up close and personal with people that may be suffering from COVID. They're the people that, when you dial 911, get dispatched to your house. If you have an individual who's ill in your house, needs immediate medical treatment, there's no time to try to debate and discuss all the different protocols that are needed. Right now, they've been putting their lives on the line just to help other people save their lives, and so we want to make sure they're the next cohort to get vaccinated. This morning, the state provided details to our EMS program agency coordinator for scheduling vaccine appointments for EMS individuals all throughout the county. It's going to be available tomorrow at 10 hospital locations throughout Westchester County. There may be some isolated individual cases of prior EMS vaccinations, but for the most part, they start tomorrow. It's also been identified through the state, the governor's reported this already, that working through two major pharmacy chains, CVS and Walgreens, that sufficient product was going to be made available. I think it's the Moderna product, which would be made available for vaccinations of nursing home staff and nursing home individuals. Most of the folks who are in nursing homes are either of advanced age or some advanced level of illness that require round-the-clock medical treatment. The staff that works with that are dealing with the most sick people, even those that are in more dire straits than might be normally in a hospital if you do a cross-section of all the people that are in the hospital, not just COVID patients. And we're anxious to make sure that we have all of those people dealt with. So as we go along with these updates, we'll give you more information about the vaccination. The county is not delivering the vaccination at this stage of the game. The local governments are not delivering the vaccinations. Our Director of Consumer Protections, Jim Maisano, cautions everyone, do not fall for any scam. Anyone that calls you and says you can get a vaccination right away if you pay a certain amount of money, if you do a certain type of thing, they are not being given out in advance of the protocol as has been laid down by the state and by the federal government. But we're grateful that the vaccines are starting to arrive in Westchester, are being administered in Westchester, and we think that's appropriate. Now, there's been some discussion about allergic reactions to the shots. The general population has not yet been given the shots and probably won't be for a while yet. But, there's some general concerns. So I just want to state some of the facts that have been laid out for us that generally speaking, slightly more than one individual within 1 million doses given might represent an allergic reaction to the vaccines. That's at a general number, all vaccines. With the emergency use authorization of the Pfizer-BioNTech COVID-19 vaccine by the FDA, the task force recommends certain guidance for physicians and other providers. That's available through the FDA, Food and Drug Administration, and the CDC. The Pfizer vaccine is to be administered in a healthcare setting where any reaction, any anaphylaxis reaction can be treated immediately. All individuals who are given the vaccine are observed for at least 20 to 30 minutes after injection to look for adverse reactions. So if you do receive one of these vaccine injections, you are not go home, find that you're sick on the way home, or you get home in 10 minutes and then you start to react. You're meant to stay so that you can be observed. And then if there are reactions, they would be managed immediately with epinephrine, EpiPens at the first line of treatment. The Pfizer vaccine should not be administered to individuals who have a known history of a severe allergic reaction to a host of different products, polyethylene glycol being the most prominent one. It is a component of this vaccine, and it can cause anaphylaxis for those people who are sensitive to it. Now, in all of these situations, we're dealing with a very small cohort of all people. You might know that about yourself because you know your own medical situation. You may not be knowledgeable about that, but all of these things are built into the analysis that was done in testing these vaccines and making sure that they are safe for general use. Individuals may react individually to this, and that, of course, is trying to be built in so it can be monitored and be protected from that. There's also a factor which those of us who are not scientific might not really appreciate, but the Pfizer vaccine is not a live vaccine. We're accustomed to thinking of vaccines as being a small dead portion of whatever the infection is that can be injected into you, and then your antibodies build up a defense against that small portion of the virus that then allows you to defeat the larger virus when it comes. But if you are immunocompromised, if you have a compromised immune system, that might come for people who are HIV positive. That might come if you're taking cancer treatments. Any number of things might make you immunocompromised. You should alert your physician in advance if you are scheduled to receive one of these inoculations, and there'll be a discussion about your particular case. And there are board-certified allergists and immunologists who are available for your doctors to consult. This is not something that's been done slapdash. This is not something that's been done to meet some type of a public deadline. This was fast-tracked, but it was done with all of the appropriate scientific thresholds reached. And I certainly have confidence that whenever it is my turn, based on criteria, not based on any other factor, whenever it is my turn to take the vaccine, I will take it. And I assume it will be effective and will help me, and we'll still practice social distancing and mask wearing and all the things that we're supposed to do until the totality of the population has been inoculated against COVID. But for those of you who are worried about how will I react to this, There can be a reaction in a very small cohort of individuals. There's a protocol laid out for how that would happen. And if you're getting the vaccine for whatever reason shortly, you have any concerns, consult your physician. They will know your circumstances, and they can portray that to other medical professionals if you're in line for a vaccine. If you are not yet in line for a vaccine, I would say as best as you can, try not to worry about it until that point in time comes. Again, consult your physician. That will help. Two issues that I want to cover as we approach Christmas holiday: the weather, which is always an issue with us. Weather's been a little warm lately. We're seeing some of the snow that fell last week start to disappear. And then also there was a particular incident in Yonkers, a very severe car crash. And Ken Jenkins, our Deputy County Executive, who monitors all sorts of activities within the county, he and I are partners in this. I want him to sort of give a quick update, report on that for our best interest, and then we'll take it from there as soon as I untangle myself. And we are good to go. Mr. Jenkins.
Thank you, County Executive. It is winter, and we are monitoring again through our Emergency Operations Center and the folks and the great folks at Emergency Services, Acting Commissioner Richard Whitney, and certainly Deputy Commissioner Susan Spear, that we're expecting a strong frontal system to move through the region during Thursday evening into Friday morning, with a potential for heavy rain and strong and damaging winds, as well as minor coastal flooding. The high wind watch is in effect for New York City and all Long Island until Friday evening. Again, this is the winter, and the same kind of precautions that we mentioned before, County Executive Latimer mentioned at the snowstorm, will be in effect. So when you go to the Gas and Go to get that last-minute holiday gift, make sure that you fill up your car. You make sure to have water and blankets and all those things in your vehicle to ensure that should you get into one of those situations, and of course you should be trying to avoid that travel, as we've been suggesting throughout the pandemic, that should you be in one of those situations, that you would be safe. Specifically on our roads, be careful on any road that has a water body in its name, because that means heavy rain, that's potential flooding, and particularly pay attention and follow the directions of our public safety officers. The Emergency Operations Center folks will be staffing the hotlines from Thursday night going into Friday morning. So certainly they're going to spend Christmas Eve going to Christmas morning, being able to protect the good people of Westchester County and all of the individuals that are involved in that. We really thank them for that opportunity and making sure that they continue the hard work on behalf of all of us. Unfortunately, at this time of the year, we always have tragedies when people are traveling around. And in Yonkers, we had a heartbreaking incident last night, and the crash is remaining under investigation. But we certainly, first, our hearts go out to all of the family members of the people that were lost. 5 individuals were tragically lost in this particular accident. And we always need to be on the ways to look out for making our roadways safe as possible. Unfortunately, this year, while traveling has been down because of the pandemic, the stats for speeding this year are much higher than they were for last year. So with the total stops and total summonses down, a percentage of stops for speed from our Department of Public Safety is essentially up 9% year to date versus 2009. We continue to ask County Executive Latimer and all of us continue to make sure to ask all of you to take your time when you're traveling, making sure that you get to your destination safely and securely. And we want to make sure our Public Safety Department will be out as they normally would be during the holiday season to ensure that people are traveling safely, buckling up, and making sure to monitor and maintain the proper speed limits. Thank you so much.
With that, I want to touch on one other item before we go to any press conversations that we've had, or 2 items, actually. We will be reporting next Monday. We will be doing a telephone call report next Monday that will update the information that we need to have, and then we'll have a regular report along these lines on Thursday, which will be New Year's Eve day, and we'll have an in-person report on Thursday, which will be the 31st of December. And we've had the pleasure of having mayors of some of our major cities with us: Mayor Bramson of New Rochelle, Mayor Roach of White Plains, Mayor Patterson Howard of Mount Vernon. We intend to have Mayor Spano with us from the city of Yonkers, Mayor Rainey from Peekskill, and then as we go through these updates, because we're going to continue them on a twice-weekly basis for the foreseeable future, we'll have other mayors of villages with us and town supervisors, as we've had in the past, so they can report on what's happening in their locality, and we'll touch on wherever you live, your locality, by some of the localized things that are happening. I also want to mention that yesterday we were able to announce, and we're going to have a more formal press conference the first week of January, that we have some new senior management in the Department of Corrections for Westchester County. A couple of weeks ago, our first Deputy Commissioner, Lou Molina, announced that he was going to be leaving us to take on a promotion, a very significant job in the city of Las Vegas in Nevada. It's going to give him responsibility over multiple departments there, and we're very happy for Lou. Lou was an exceptional contributor to our work in the Corrections Department. We've recently undergone some evaluation by a number of federal organizations, and they've given our county jail, our Corrections Department, very high marks for innovative programs. We've covered some of that in past press conferences. And our Commissioner Joe Spano, then First Deputy Commissioner Lou Molina, and current Deputy Commissioner Leandro Diaz all take tremendous credit for the great work that was done. We said goodbye to Lou very sadly, but he was going on to a promotion and a better opportunity for him, and I'm sure his career will advance and perhaps back into the New York area before we know it. But in the spirit of moving forward, we've announced that Ms. Nori Padilla will be promoted to serve as First Deputy Commissioner for the Department of Corrections. She will work as the second-ranking official within the leadership team. Ms. Padilla, will go over her curriculum vitae, and we'll have her here with us for this, is a lawyer as well as a professional in the area of counseling and therapy. She's been very much intrinsic to many of the innovative programs that we have over there at the correctional institution, and we're very happy that she's able to take this promotion on to become First Deputy Commissioner, and she will be among the highest-ranking Latinas in our county government. We do have a commissioner of our information technology who is also Latina. She is the highest-ranking member, but Nori will be right there. And then, of course, we do have continuing Deputy Commissioner Leandro Diaz, who's been with the Corrections Department for many years. Leo, as we all know him, has done a fabulous job working on the team. And we're adding a second Deputy Commissioner. We've had a second Deputy Commissioner position available for the last few months. We have now Michael Gerald, who will be joining us. Michael Gerald is actually pastor, Reverend Michael Gerald is pastor of the Shiloh Baptist Church in Tuckahoe. But separate from that, he's a law enforcement professional. He has served as a New Jersey state trooper over a number of years. He has a great background in law enforcement. We asked him, appointed him a while back to head our Citizens Correction Advisory Board, and he's done a terrific job in that. And now he's actually joining the team as a deputy commissioner. So we have a very diverse group at the top of the pyramid. Commissioner Joe Spano, First Deputy Commissioner Nori Padilla, Deputy Commissioner Leandro Diaz, Deputy Commissioner Michael Gerald, and we think that is a good team to move forward our correctional team. And again, we hope to have them all with us here for an announcement. And over the course of the coming weeks, we're going to announce other appointments that we have scheduled for a variety of other positions. You can look for positions that we're going to announce here in the Communications Department, in the Parks, Recreation, and Conservation Commission. It's important to understand that Westchester County has set as a priority the people who work for the administration must be individuals that we believe can do the job before them in an expert fashion and hopefully in an exceptional fashion. And that is the first and most important criteria. We're looking for diversity, and we want to combine that ability with that diversity so that we have people in positions that they can excel in and at the same time show people that we are diverse and the doors are open. We have hired very many women to serve in many significant positions, commissioner positions, positions here in the executive branch. Our number 3 person on the team is Joan McDonald. You've seen her before. And we wanted to be very clear about this. Now, in the discussion about these things, there's always discussion. There's some debate out there, and you'll hear different people with different points of view. We welcome different points of view, but we want to be very clear about what we've done. We know we've done the right thing. We've done it, we think, as well or better than our predecessor administrations, and we stand by those decisions that we've made. And we're very happy that Ms. Padilla and Reverend Gerald will join that team in corrections, and you'll see other people join us as well. And I think the fair-minded person will see what our outreach is and how hard we've worked to have people, men and women, people who are Caucasian, who are African American, who are Asian and Latinx, people who are straight and people who are gay, and all across the age demographics, that we have that diversity. I'm proud of that, and I'm proud of the people that work for Westchester County government. So we'll talk more about that as we go forward. With that, I'm going to ask Catherine Chaffee, our Director of Communications, if we have any questions from the press, which we'll do our best to answer.
We do. The first question comes from Samantha Crawford. She asks, with some school districts going 100% remote the first week of January, is the county and or the county health department giving any guidance on what school districts should do, considering there could be a surge after the Christmas holidays, as there was after Thanksgiving? And what is the county doing to prepare for another surge?
Well, Samantha Crawford from News 12, we've worked very closely with the various school districts. There are 44 school districts in Westchester County. They range in size from Yonkers School District, roughly 27,000 students, to some of the smaller districts that have slightly above 1,500 students. So there's a real variant range. The decision on whether a school district is open or closed ultimately belongs with the school board of that community, and they are in direct contact with the state education department to determine what the protocol is for how they intend to advance the learning methods, whether it's all remote, whether it's hybrid, or in some cases if the students are back in school. So those decisions are not made by the county. What we do with our Department of Health is to work very closely with each of the school districts to help them accomplish what they've identified as their mission. And if it is protocol for sanitization, if it is assistance in providing PPE, if it's testing, which is really the big issue right now, depending on how the schools prepare, there are requirements by the state to test certain percentages of students and staff to make sure that they are COVID negative in order for them to participate in teaching and learning, that the county is a direct partner with it. Our plans really depend on the school district, and we work individually with each school district. We have the circumstances of school districts that fall in the one orange zone, Portchester, or in the 5 yellow zones that have been established by the governor. There have been no expansion or change in those zones. Those zones do require a certain amount of testing, and so the county is working with the school districts to help accomplish that testing, and that testing is done with the direct assistance of the state as well. So that's one of the ways we're preparing for that. We are concerned, as I just mentioned, with what happens at Thanksgiving. We saw it. It's real. It's not a fake. And now we worry about the same thing with Christmas. Christmas is fundamentally the same type of holiday for families that Thanksgiving is. People get together, they socialize, and they drop their guard when they're in close proximity to people that they're related to or are close family members of. But if you're not in the same family unit every day, then you run the risk of spreading a virus. And we've said it before, we are not going to have the county police knock on your front door just to check up on you, but you need to use your common sense and determine what represents a reasonable gathering of family. And if you can avoid that gathering, as hard as that may be, because we all know what the social interaction is at Christmas time, New Year's, and so forth, you would be wise to do that. We will certainly step in when we think there's some kind of organized grouping that becomes a significant number of people. The governor has already said, under any circumstances, groups of 50, no more than 50, no matter what the circumstances are. And where we hear stories of 100 people gathered, then we know that that is inappropriate, and we will deal with that, as opposed to just circumstances where there are 12 people in a location. But we will work directly with the school districts to make sure that they have the tools that they need for sanitization, for testing, and if they decide that they're going to open partially through hybrid or all in, we'll be there for them. If they decide to operate remotely, we'll be in standby mode to help them.
Next question, and the last question, is also from Samantha. Just to follow up to the county executive's response about amping testing at the Westchester County Airport, who would the test specifically be used on, and would the CE want international travelers traveling through Westchester County Airport, Westchester County Airport, to be tested, or just those from the UK?
Well, first of all, there's very little transferring at the Westchester County Airport. We are an endpoint destination or a point of origination for most trips. Airports like Atlanta, Dallas, Chicago, O'Hare are the major airports in the country, which are transfer spots where people will come in, land at that airport, take a flight, then going to another location. We are a small destination airport in the New York metropolitan area. The larger airports, LaGuardia, JFK, and Newark, get the bulk of the travel. We get a smaller portion of it. Secondly, we have a very small portion of commercial flights that are coming in and out of the airport at the moment. It's trickled down to nearly no flights, and under the most busiest of circumstances, the commercial side is 20% of the total air traffic. Most of the air traffic at this airport is general aviation. So what our ask is to determine what we can do with the FAA, which controls what happens with flights, to determine from the general aviation side, which is still the part that's most active. That's corporate jets, individual flights that are taken by individuals who own jets and so forth, and how will we be able to apply some testing version to determine those people that might be coming from different locations. Because the spread of the disease is UK based, as we have heard, this new strain, and because the governor has taken steps to do certain things that would affect commercial flights that come into New York State, and that would primarily be JFK and LaGuardia, but not limited to that, flights that come into Buffalo, Albany, and some of the other major airports. We want to be consistent with that effort. So our ask is to determine what can be done, what's within the authority of the FAA to do, and then what assistance the county would need to do in order to help advance that. Because it's general aviation, we don't think this is going to be a large cohort, but it could be any set of circumstances that could still be important. But we don't know that the new strain of virus isn't here already. It could well be here, because when it first gets picked up, just as we had the first time around, it was called by some the China virus, and yet there seems to be very strong indications that the virus was already here in January, may have come through European locations, and that may have begun in China, but this is a very mobile society that we live in, and people, move about very directly. We don't get flights at Westchester County Airport, commercial or private flights, that come directly from the UK, and that's primarily because we have a short runway for that purpose. If you're going to travel over that long a distance, you need to have a plane of a certain size that can carry enough fuel to make it across the Atlantic in a direct flight. And then a plane of that size that has the fuel carrying capacity, and if it's commercial, the passenger carrying capacity, could not land at Westchester County Airport. So the concern would be someone that flies into a hub and then takes a hop flight into Westchester County. You fly into, say, Philadelphia, which is possible, London to Philadelphia, Heathrow, or Shannon or Dublin into Philadelphia, and then someone takes a smaller flight, a jet flight, perhaps a corporate jet flight, one of the FBO operated situations that might take them from Philadelphia into Westchester County Airport, because their final destination is Greenwich, Connecticut, or the final destination is Armonk, New York, or Scarsdale, New York, wherever they're going. And that could be the basis of that. And particularly if the connecting flight is not at JFK or LaGuardia, then it is possible that the virus could be advanced. But we're not in a position to be able to know how those things connect, so we're relying on our relationship and the direction of the FAA and the state of New York, which through the Port Authority of New York does have control of the other major airports in the area, if not ours. We will try to work through these things, do the very best we can, try to interdict where we can, but I think we have to understand that this virus is nowhere and it's everywhere at the same time. And it is certainly possible that even with our best efforts, the new strain of the virus could be in our backyard, even as we speak. So we'll do the best we can, and hopefully we'll have some positive. We won't really know if we're effective, because if we stop something from happening, then it doesn't happen, and so you don't know that it was going to happen. That may seem a little odd and obvious, but nonetheless, we'll do what we can do to deal with this as best as we can. If there are no other questions, we invite any members of the press to reach out to us through Catherine. We'll be happy to have one-on-one conversations. Our next update, again, will be on Monday, so there's a long weekend ahead of us because of the Christmas holiday. We want to wish all of our Christian friends, those who celebrate Christmas, a very Merry Christmas. And then immediately after Christmas, the next day, the 26th, begins the celebration of Kwanzaa, which is an African heritage event that will last for the next 7 days. And so to all who will be celebrating Kwanzaa, we wish you a very happy and joyous Kwanzaa. And we'll see you again, or we'll talk to you again on Monday with an update. We'll update the numbers. And now you can look at the dashboard anytime you want. I'm George Latimer, Westchester County Executive. Thanks for watching, and have a good day. Merry Christmas.